5.5.
1, 2, 3, 4, 5, 6,
joining. We are live in San Antonio, Texas with Dr. Jeneby, and I believe Dr. Phillips is coming in here too. We are doing the fourth case of the day, which she is doing lipo 360. BBL, she's doing a removal and replacement of one of her left implant. She's doing a breast lift with J-stitch and a dog ear revision. She had tummy tuck before, so we're doing a dog ear revision. So she has a lot going on, and we're really excited for her. That will be incredible when she's all healed up. It's going to look great. If you guys have any questions at all, please feel free to ask. We are happy to answer anything, whether it's getting ready for surgery, what post-op looks like, recovery process. If you want to learn how to book a consultation, we offer both virtual and in-person consultations, and we also offer in-house financing, third-party lender financing, cash discounts, etc. So there are many options to.
2030, left side?
375 cc left side. Yeah.
There are many ways to book your surgery and be able to pay for it. We offer many options to be able to finance that dream body. We do have our July specials up as well. They just launched today, so we have our combination procedures are on special, our thigh lifts are on special, and our M-Sculpt is at a discounted rate for summertime, so that's great. You can always see our specials pinned to the top of our social media channels. Hi Cindy, hi. Oh, what's this? Kimberly, hello. Hi Lisa, Nikki, good almost afternoon. We are working on the breast portion of this surgery. We already did the BBL and the liposuction, and now they are doing the breast augmentation as well as the lift will be next.
What are we putting in? 375. Yeah.
I see a lot of you hopping over to YouTube here. That's great. You guys can see the surgery going on. So as you see on YouTube, you can see, I'm going to zoom in a little bit here. Let me try to move that this way. Okay. On YouTube, you can see the implants going in.
What size is this? 400?
I think it's a 425.
400.
Alright, we have 12 people on YouTube now, so this is really trending. Usually we only have a couple.
You put his just any 400 from Mackenzie. UHP would be desirable.
Right. So guys, if you have any questions, feel free to drop them in our comment section here. If you're interested in booking a consultation or learning more about our pricing, You can fill out the form on TikTok, the blue form in the bottom left corner that says contact form, and on YouTube you can provide your email in the comments here, and I can have our team start a conversation with you to get you on the books. She already had the lipo done to the lipo 360, so the lipo on her front side and back side. She had her BBL done already, so now we're just working on the breasts. And she's going to be on her way looking fabulous. We are showing this on YouTube for our TikTok viewers. If you want to hop over to YouTube, you can see the surgery going on. I do have to stay back some just for sterile purposes, but I try to get as good of angles as I can.
This is gonna be on the right?
Yes. Drop one?
Yeah.
Do you need that sticker that's on the front of it?
No, not this one. She said she didn't need it. I guess I'll keep it for her just in case.
So you're gonna pop it aside.
No, so we get consent from all of our patients prior to their surgeries to see if we are allowed to film. We also get consent for, yes, to social media, but we get consent in addition to that for each particular platform. So some patients only consent to Facebook or Instagram or TikTok. This patient has consented to YouTube, Instagram, and TikTok, as well as Facebook. So, I mean, yes, technically it would be if she did not consent, but we do have them sign 2 consent forms prior to going live with them. And if they say no, we don't do it. So.
All right, brand new.
We have Dr. Jeneby and Dr. Phillips in here today.
Hey, Carol.
I think it'll be better too.
Guys, for those of you just joining us, we are live in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. We are on our 4th case of the day doing lipo 360. She's also doing breast lift and removal and replacement of her implants. And a BBL, I don't know if I said BBL, so Brazilian butt lift. She's also doing a J-stitch to her breast aug, which is going to help bring in the breast lipo so they don't fall to the sides. So that's a very common add-on for our breast augmentation procedures. Thank you. Yes, everything's going great. She's almost done. So the last portion, she just needs to do the implants and the lift, and then I believe she's done.
they tried to get back in the building, they won't see nothing. They can't see it from the street. Oh, don't get at us then. If they take that down, they have to give architect plan, they have to give this architect plan. They're so crazy about it, that's how much it's going to each way. They're very honest about it. Talking about their high range is on the media. Color they should be able to fight about it.
Oh my god.
Fight about the color of the flowers on the media.
I'm going to go ahead and pin our form to the screen now. Every so often it lets me pin onto the screen. And that is an easy way for you to fill out the contact form to book a consultation, learn about our pricing, get more details about our specials going on, financing options, etc. So it's a great way to get in touch with our team. Hi everyone. Dr. Phoebe, Jacqueline, hello. Good afternoon now. We're at our lunch hour, 12 o'clock. Everyone's probably on lunch watching us.
7.5. This is 40.
So we have our implants and now we're getting ready to do the lift. And again, for our TikTok viewers, if you're interested in watching the surgery, you can go to our YouTube page through the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery, and you can see the surgery happening there.
Bro, I don't know, where do you think this is? Looks still pretty good, man.
Last one, you kind of.
Last one you kind of just.
I turned my head when I did that.
Yeah, that was your master stroke?
Yeah. I heard it pretty good.
So this is something that we do every day. We get on the lives, and we, as long as the patient has consented, we get on our lives and we're able to answer questions and help educate anyone who's wanting to know anything about plastic surgery or getting ready for it or recovering from it, anything you want to know. Typically anywhere from 6 in the morning to about 2 in the afternoon, sometimes a little bit later, sometimes a little earlier. We are on here to answer these questions. We have a question of how safe is anesthesia?
Depends on much
doing
safer than him. Exactly.
Who's doing
We had
it?
a 30-year guy doing it.
So he's been doing it for 30 years, so it's very safe because he's monitoring
Probably
everything.
safer than driving your car
Safer than driving your car is
in
what
San Antonio.
in San Antonio, so Dr. Genevieve said. But
Physically
he's been
speaking,
doing this for
more
30
safer
years.
than driving your car.
We have all of the monitors up. We're monitoring, pulse ox and heart rate and blood pressure, all that stuff while the patient is under. So
Sit her up, doc.
definitely, she's in great hands here. So we are in San Antonio, Texas. We're in the Stone Oak area. Yeah, of course.
Oh, man.
Yes, no problem. Where are you guys located? Where are you from?
More on this side.
So you can schedule a consultation you can send me your email or phone number on here since you're on YouTube, or you can hop over to our Instagram or TikTok and you can send us, fill out a contact form through our link tree, through our link in our bios. I believe there's also a link on our YouTube profile that goes to the lead form.
Okay. See, let's pull this up. Make it over a little bit.
Jacqueline, Iowa. Yes, well, we can definitely help with that. We do a lot of arm lifts and tummy tucks. Every week we're doing those. We did a thigh lift earlier today, but it's very common for us to do the arm lifts and especially tummy tucks. Those are really big. Arm lifts are usually if the patient's lost a lot of weight or had.
All right, we're good. Heather?
All right,
We're start
guys.
closing her up now. Thank you guys for watching.
All right, guys. I'll give you about 30 more seconds here to fill out these forms, and then we will see you soon. We'll see you tomorrow. Oh, nice. Good job. That's awesome. It's a lot of weight to lose. That's a wonderful accomplishment.